Swallowing, worsening indigestion or heartburn, and coughing or hoarseness are just some of the signs of esophageal cancer. Please welcome Dr. Gregg Silverman joining us right now. You said weight loss too.
And weight loss, that's correct. It affects about 1% of all newly diagnosed cancers in the United States are esophageal cancer. And there are generally two types. One is from the upper esophagus and the other one's from the lower esophagus. And there's some risk factors for that. Again, the risk factors are smoking, like everything else, all the other types of cancers there are. GE reflux, which is interesting, mostly this affects men. This affects men about 4 to 1 over women.
And what is that? Just because we eat heavier foods, or I mean, is it something as easy as that?
Unclear exactly. Again, one of those where you don't quite know why it is that this affects men more than women. You know, but it does. And what we're seeing is just the type where the esophagus is, and generally, you know, the cancers can start on any part of the esophagus. If they're started on the lower part, they're generally a different type of cancer than up on the upper esophagus, which is generally a squamous cell carcinoma.
It seems like this can be confused with maybe some of the other symptoms. Are like,
correct.
Like, well, why would I even think it's esophageal cancer?
You wouldn't.
It's down there.
You wouldn't until you start losing weight, generally, until people start getting pain, or until the tumor starts impeding the travel of food from the mouth to the stomach. That's when generally it happens, and by that time, the tumors generally are farther along. What you want to do in any cancer is catch them early, and sometimes we know that there's a transformation of the cells between normal cells and cancerous cells, and those are generally seen on esophagogastroduodenoscopies.
I'll say when they go in.
If you ever take a look, that's correct.
And now, is that biopsy? You go in there and remove it, or is it standard radiation chemo?
It's standard radiation chemo. There are types of surgeries that you can do that can remove that part of the esophagus, which will hook sort of the stomach up to the esophagus. Sometimes you just remove the entire segment and then put a feeding tube in, because you have to get nutrition. You got to get the food there somehow.
Recovery time typically?
It depends on what the surgery. Depends on how difficult the surgeries are. Generally, several weeks, and certainly the whole other transformation after that, which includes chemotherapy and radiation therapy.
Tough. Dr. Silverman, we appreciate you coming in, sir.
Nice to see you again.
Okay.